Welcome to the program. This is me, Michael Chand, again from the DISHARC Media and Communications Department, the DIMCD we call it. This is now another interesting series in our regular presentation, like interviewing consultants, senior consultants of DISHARC. दर्शकवृन्द एउटा सानो निवेदन के भने यो हाम्रो विभिन्न किसिमको इस्युजहरूलाई लिएर हामीले DIMCD सञ्चार विभागका तर्फबाट हामीले यस्तो प्रसारहरू गरिरहेछौँ। विभिन्न इस्युजहरू छन्, विभिन्न टपिक्सहरू छन्, तर आजको टपिक चाहिँ यति विशेष खालको टपिक छ, which I think hasn't been heard anywhere in the media, because we are going to talk on a very interesting topic. The विषयवस्तु हाम्रो कस्तो छ भने आजसम्म मैले थाहा पाएअनुसार यो अहिलेसम्म मिडियामा कहीँ पनि सुनेको छैन र त्यो कुरा हामी आज सुनाउँदैछौँ। What I'm trying to tell you is I'm interviewing the eminent dermatologist of this country, Professor Dr. Anil Kumar Jha, a very familiar name. He's no stranger. Time and again he has been appearing on the screen, he has been facing the camera. त यस्तो कुरो के हो भनेदेखि यति सुविख्यात डर्माटोलोजिस्टसँग बसेर आज छुट्टै विषयमा हामी कुराकानी गर्न गइरहेछौँ। डाक्टर साहब, वेलकम टु द प्रोग्राम।
थ्याङ्क यू, धन्यवाद।
प्रायः जसो चाहिँ डक्टर्सलाई इन्टरभ्यू गर्दा उहाँको देन, उहाँले कहाँ पढ्नुभयो, अनि उहाँले चाहिँ कसरी डिग्रिजहरू हासिल गर्नुभयो, कहाँ सेवारत हुनुहुन्छ, द्याट इज नट आवर टपिक। आजको टपिक हो डक्टर पेसेन्ट रिलेसनसिप हो इन्टरभ्यू। त यसलाई अहिले नै नभनौँ, what we are going to discuss on. So the viewers and the honorable listeners, they will simply try to make up their mind as to what we are going to talk about. Dr. Saab, let's go to the topic.
Okay.
Allow me to do that.
Please, let us proceed.
You as an eminent doctor, dermatologist, Professor Dr. Anil Kumar Jha. Dr. Jha, can you define patient? What is a patient?
Well, I think nobody has asked me this question before. I have faced so many. Yeah, it is true. I have faced so many interviews of my the graduation level, post-graduation level. This is very important. And after that, so many interviews I have faced in television, national television, and all that. But nobody asked me this question: that how would I define the patient? This is very important that all doctors should think on that. And immediately when you asked what is patient, in fact, it is very difficult to define, because I'll tell you that none of our medical books, कुनै पनि हाम्रो medical books मा disease भनेको के हो सबै described हुन्छ, तर patient भनेको के हो, there is no definition there. So we have to make definition when you have asked. And so I would say that patient is the person who is at the physical discomfort, medical discomfort, socially discomfort. So mentally, socially र physically कुनै व्यक्ति यदि अप्ठ्यारोमा छ, डिजिज छ, कुनै रोग लागेको छ भनेदेखि अनकम्फर्टेबल अवस्थामा छ, इज छैन भनेदेखि that particular person can be defined as a patient. किनभने डिसइज वर्ड नै दुईटा शब्दबाट बनेको, जो चाहिँ कम्फर्टेबल छैन त्यो डिजिज हो, त्यो मानसिक होस्, शारीरिक होस् र सामाजिक होस्।
डाक्टर साहब, इट्स अ भेरी गुड डेफिनेसन। डाक्टर साहबले भनिहाल्नुभयो, you have never faced a question like
this. Never.
Like defining the word patient. And I'm asking, you to define that, and you did it. And it's good to hear that you are saying that this word patient is found not well defined anywhere.
Anywhere, not at all.
Yeah?
Yes.
So now let's move on to the second question. मेरो अर्को प्रश्न के हो भने, normally doctors, they feel themselves superior in terms of their qualification, in terms of their expertise. They are MDs and all sorts of degrees they have got, outstanding surgeons, MCS, so on. And the patient is more or less like a helpless person in front of this particular doctor, or the doctor, whoever is attending on him. Do you agree?
Yep, I agree.
This point?
I agree.
Can you give me some examples?
I agree, but agree to the practical aspect that is being thought of. And I tell you why. There are two backgrounds regarding this. One is that in book, always, it is English, where you is used for the small or big, whoever you say it is you. But there are some languages like Nepali, like Hindi, where for the superior person you use some other word, for the juniors you use some other words. And it has been, in training it has been told that whoever patient is in front of you, talk to him as if he is your inferior. Like suppose, I can't express in English because you is for everyone. But in other language like Nepali and other language, you have degrees of addressing the people. So that is used, and when you talk to the patient, here in our scenario, we talk to the patient as seeing inferior. That means you call it like in Nepali, जस्तै हामी भन्छौँ बिरामीसँग कुरा गर्दा बिरामीलाई युजुअली तिमी भन्छौँ, जबकि हामी झन् रिगार्ड गर्नुपर्ने. तर agree जुन मैले गरेँ, the extent of the agree that was expressed by me was at the practical aspect of what is happening. But personally, as a doctor, personally as a person, I do not agree to it, because I feel that I always tell my students, as I am still a teacher, so medical teacher, so I teach my student the first class that I take, and I tell them that the patient can survive without doctor. This is my always a address to my students and my junior colleagues, that again I am repeating, patients can survive without a doctor with grace of God. But doctor cannot be called as a doctor or clinical doctor till patients are not there. So doctors are because of the patients. So they are superior than us. So we should regard them, but because they have given us the chance to serve them, given us the chance to have our profession going on. Otherwise, if no patients, means where we are. And I'm giving you a practical example. The doctors who have no patients to come in their clinic, do they feel that they are really a doctor? You are a doctor when your patient is in front of you. Otherwise, what you are? Of course, if you are non-clinical, if you are just a scientist, not dealing with the patients, it's okay. But, and that is also, PhD are also called a doctor, that's why. But this doctor, the medical doctor, the clinician, for them, patients should be more important than themselves being a doctor.
So in other words, in a way, it is very true that if a doctor sees a bed without patient, then well, that must be a different feeling. The दर्शक वृन्द एउटा कुरा म यहाँ निवेदन के गर्न चाहन्छु भने कि यो प्रश्न सायद अरू डक्टर्सहरूलाई पनि मैले सोध्ने मौका पाएँ भने, well, if provided I get the chance to ask the similar question or to pose a similar question to other doctors, maybe the definition would come in a different way. Because they might say, yes, a doctor is always a qualified person. They might even say, yes, a doctor knows much better than the patient. and the patient is lying there, and we are the ones to treat. Whereas we heard Professor Dr. Anil Kumar Jha approaching this subject in a different way, because the patient-doctor relationship is really vital, and we are coming more on that later on.
Yeah.
But now, the reason, now I'm coming to the point of this interview.
Yes.
The reason why I'm asking you is that you, as a prominent doctor, well, you were hospitalized
Right.
some months ago, am I right?
Yeah.
Due to a sudden illness.
Right.
Then you had to stay there for medical treatment for a couple of days as a patient,
Right.
not as a doctor.
Right.
What was the transformation of the general feeling you had as a patient despite being a great doctor?
So I maybe somewhere in the history, but as my knowledge allows me, I have never heard again asking this question to a doctor. So I think maybe very rarely somebody have been asked about this. Now the real purpose of the interview for today was this, that how doctors feel being a patient.
Yeah.
So the other way around, and I'm giving you as you have asked me. Yes, I was admitted for unknown reason of fever. I had a fever and weakness without any known cause. So I had to be admitted for 24 hours. I was supposed to be there for 2 or 3 days, but I tell you, I almost ran away from the hospital because I cannot stay there for long. That's what I wanted to tell you, admit also. And that's very important. Now, as soon as I was asked to be admitted for investigations to find out the cause of the fever, अनि म भर्ना भएपछि पहिलो कुरा म भित्र गएँ. I was having a high grade fever with giddiness, ulti bhaira थियो मलाई, र ultimately it was found to be a viral type of fever only, र मलाई कुनै पनि hypertension छैन. I am not suffering for any diabetes. I don't take any regular medications at the age of around 60 now, so I am going to be 60 very soon. And तर पनि when I simply had a fever and that sort of things that I have just explained, म त्यो बेला चाहिँ I realized that what the patient is. किनभने जुन मैले कष्ट पाएँ एउटा ज्वरोमा, भन्नलाई एउटा ज्वरो मात्रै आएको थियो, मलाई कुनै गम्भीर समस्या भन्नलाई not it was not labeled as such. र मैले के पाएँ, and then I was provided a very obviously I'll not name the hospital, but of course, but म जुन केबिनमा एडमिट भएको थिएँ, that was a deluxe cabin.
Oh.
And you can imagine that was the best cabin available in that hospital, and I was admitted there. And as soon as I entered inside, I on the switch of a bathroom that was not working, number one. Number two, I was ill, I was sick, I went there, I was admitted, and I went to the bathroom looking for some brush, and it was a deluxe cabin. Now I had to ask somebody, being dependent, that okay, bring a brush for me. So in fact, I started again thinking that what patient expect from the doctors, what patient expect from the organization or health organization or hospital or clinics. So when patient is paying so much, here यहाँ त अब जुन general patient को त कुरै छैन, त्यो त कहाँ हो है. We can't even compare that environment. जुन best available cabin मा जाँदा यदि कुनै patient लाई जाने बित्तिकै switch on गर्दा light नबलेपछि बाथरुममा, and you are not feeling well, what you feel, त्यो patient त्यति बेला के feel गर्छ. And being a doctor, being a patient as well as त्यो बेलामा मलाई जुन feeling आयो, that sometimes it strikes my mind, and I think कि patient को psychology त्यो बेला बिरामी भएको बेलामा कस्तो हुँदो रहेछ. र म भर्ना भएँ. I had to, being such a senior doctor in the country, पनि मलाई कयौं पटक निड भयो र त्यो बेलामा चाहिँ what I was expecting from the doctor at that time, I was a patient, मैले चाहिँ त्यो लेभलको सर्भिस मैले पाइनँ अनि त्यो बेलामा मलाई अझै धेरै फिल भयो and it touched my heart that पेशेन्ट जनरल पेशेन्ट जुन जनरल वार्डमा भर्ना भएको हुन्छ, जनरल हस्पिटलमा वीर हस्पिटलमा भर्ना हुन्छ, उनीहरूको कति दुर्गति होला भन्ने त्यो 24 आवर्स वाज ए स्टडी आवर। मैले के सोचेँ भने मैले यति पढेको छु, एमडी गरेँ, मैले एफआरसिपी को डिग्री पाएँ या मैले एमबीबीएस गरेँ, यति लामो पढाइको उसमा यो फिलिङ मलाई त्यो बेलामा ठुलो चाहिँ लेसन पाएको, मैले चाहिँ लेसन लर्न गरेको मैले फिल गरेँ। आई फेल्ट that 24 hours was my big class. It was a very important class for me being a patient. So I request all my colleagues who are doctors, medical doctors, the clinicians, that please give some time thinking that when you are patient, how you feel, so that certainly you will be changed to some degree maybe and you will treat your patient better.
We don't want to instruct. This interview is not giving you any instructions to all the doctors. But what we want to say is that you monitor the situation. Go to the patient and at least you should understand what they need and you act as if you were them, that you lie on the bed and what you feel. And that is the situation that will give you a correct answer. Otherwise, the stethoscope and the degree you have and the knowledge you have, well, you can simply hang it on the wall. Listen to what Dr. Saab was saying. Monitor the patient. Go to the patient and feel their needs. I would say the basic needs.
एउटा इम्पोर्टेन्ट कुरा जुन उहाँले माइकल ज्यूले भन्नुभयो कि फिल गर्ने, त्यसमा तीनवटा कुरा आउँछ। फेरि मैले आफ्नो स्टुडेन्ट्सहरूलाई पढाउँदा व्हेन आई एम टिचिङ माई स्टुडेन्ट्स, मेडिकल स्टुडेन्ट्स र आफ्नो जुनियर कलिग्सहरूलाई म के भन्ने गर्छु भने, वन्स इभन इन आउट पेसेन्ट डिपार्टमेन्ट, ओपिडीमा पेसेन्ट तपाईँको अगाडि चेयरमा आएर बस्दाखेरि, suppose example, some of your very close friends, relative comes there, how you treat at that time. So imagine that either you are there on that patient chair or some very close relative of yours is sitting over their chair. How do you treat that person being a patient? And when other general patient whom you do not know, how you tackle that patient? That these are important differences. If you can bridge in the gap of this part, certainly patient will be treated better. I don't mean to criticize my colleagues, and the teaching and learning methods has also become very much different than before. Earlier the moral education was given more importance, and now even the government, they have put this medical profession as a business profession. They have recorded it, classified it as a business profession. That with this interview, I would like to address this part, that I am totally against it, whatever the outcome may be, that we are not a businessman. We are not at all a businessman. And to prove that, just saying is not enough. To prove that, we have to prove by caring our patients. The respect which patient has a few years back, maybe 10 years, 15 years back, and now the respect is reducing day by day in regard to the doctors by the patient. The cause is, I think, that we are not respecting our patients. Maybe that's why they are not respecting us. So that's and we think that we have studied for such a long period, but why have you studied? When you choose a medical line, it is a line of sacrifice. Of course, we have our own family life. We have our own, we also like to be happy. That is another part. But when you come to a medical profession, never come that once you become a medical profession, come to that, you will earn like anything. So keep money as second line. We need money. Money is very important, but it is not most important. So please give first preference to the care, and the money comes behind that. Money is a byproduct. in medical profession. It should not be a aim. It should not be a I mean verdict of your profession that okay, going to medical profession means earning like anything. So that is what I mean. Respect to the patient, care of the patient, psychologically holistic approach. This is very important word that I am using. Disease रोगलाई निको पार्नु patient care होइन. हामीले हाम्रो डायग्नोसिस 100% करेक्ट होला, हाम्रो प्रेस्क्रिप्सन 100% करेक्ट होला, तर हामीले पेशेन्टलाई डिल गर्दा केयर गरेनौं, पेशेन्टलाई रेस्पेक्ट गरेनौं भने आई थिंक दैट प्रेस्क्रिप्सन इज ओन्ली 50% of what it should be. So caring a patient is very important, not only right prescription and right diagnosis. Caring in three sense, that is psychologically, socially and economically. किनभनेदेखि सबै पेशेन्ट एउटै डिजिज को 5 वटा पेशेन्ट छ भने ट्रिटमेन्ट मे बी डिफरेन्ट, द केयरिङ मे बी डिफरेन्ट. किनभने एउटा सपोज म स्किन को डाक्टर हो, म डर्मेटोलोजिस्ट हो भने एउटा पेशेन्ट मेरो अगाडि आउँछ र उसलाई यदि मैले चाहिँ 500 को एउटा चाहिँ ऑयल लेखेर दिए भनेदेखि र उसको इन्कम महिनाको इन्कम चाहिँ 3000 रुपैयाँ छ भने डु यू थिंक दैट पेशेन्ट विल बी एबल टु बाई एन ऑयल टु एप्लाई. सो त्यो बेलामा दैट इज भेरी इम्पोर्टेन्ट दैट यू सी द सोशियो इकोनोमिक कंडिशन अफ द पेशेन्ट एन्ड योर प्रिस्क्रिप्सन शुड बी बेस्ड on that. That's very, very important, and that is caring the patient as a part of it.
Doctors become sick, Dr. Saab.
Right.
I'm not saying that doctors, they should not get sick. There are even people who still believe in villages that a doctor is God, is a superior being. He doesn't eat rice, dal, bhat and so on. And that is the concept people normally have. But in reality, that's not true.
Of course.
Because the doctor also falls sick.
Right.
Now, I'm going to attribute some of the reasons why the doctors themselves they get sick is because of the continuous run from one hospital to the other. I mean, doing their duties and then attending patients, not having proper rest, starts early in the morning, and then the food is also irregular, and in the evening he just comes back home. So if this continues for a long time, certainly the Provident will always say, my God, you and your metabolism now. Then something goes wrong and the person, the doctor, feels sick. Do you agree?
Right. Yeah, I agree to it. I agree, and our body is also made of the same elements that the patient's bodies are made of, for general public. Only the thing is, yes, as a doctor, one thing is important, that you know what is happening inside you most of the time. So, and what are you instructing to the patients sometime should be followed by the doctors themselves. But as you said, hustle and bustle, it's not only the question of going from one hospital to another. Sometimes even if you are in one hospital, the duty is of course very hectic if the duty is done like duty. But the part of the duty is that you want to help others. Some professions you are working for yourself, but here the basic difference is you are working for others. So this we have to always realize, that in this profession, whatever you are doing morning to evening, it is you are trying to help others, you are trying to serve others. Whereas in other business and other professions, you are working for yourself only most of the time. Trying to bring yourself to upgrade to some extent. But in medical field, it is mostly that you have to help others, you have to serve others. So that's why in this situations, doctors of course can be ill, doctor can be sick, because it is a body, it is a temporary thing, and environmental factors, there are many things, and also mental stress sometimes can cause. You have a very little time for your family, that can give you a stress. Of course family has complained that doctors has very little time for the family, but we others should realize that doctor even thinks that even if they want to give the time to the family, they cannot give. That is the worst situation, but that is to sacrifice for others to help others.
अर्को कुरा डाक्टर साहब के हो भने
हजुर
जस्तो अब डक्टर नै पेसेन्ट भएर सुत्दाखेरि
हजुर
बेडमा सुत्दाखेरि सर्टनली मनमा त एकदमै बेचैनी त हुन्छ पक्का
हजुर
किनभने उनको सेड्युल पनि आफ्नो
हो
उनले गर्ने राउन्ड्सहरू ब्रेक भयो हेल्थ चेकअप्सहरू इन्भेस्टिगेसन राउन्ड अथवा चाहिँ भिजिटिङ आवर्स एटसेट्रा एन्ड एटसेट्रा द्याट गेट्स एफेक्टेड
yes
to a large extent, but still they have to really bear that. That means tolerate that. Otherwise, they'll have to either they must get well soon, or they will keep on lying on bed for a long time. So this is actually one conspicuous situation. Like once again, I'd like to request the doctors very kindly here that you just lie on the hospital bed thinking that you are a patient and you're going to be there for about 7 days, no movement, no external visits and so on. So that must be a real hell for you. So that kind of hell the patient normally undergoes, and as doctors I think it is worthwhile to understand
right
that situation. Right?
I agree, and that's why I said one aspect of this part is that another is that if you do not off your mobile, you get all the calls from your patients who are supposed to be there for appointments, and that is another stress. And at the same time, you should also think that as you feel uncomfortable on the bed, patient never wants to continue in the hospital, because that I give my example to my patients who sometimes they at the end of the checkup they ask me, Doctor Sahab, ma kaile aau? That's their question, and usually they ask me when should he or she come for the follow-up, and I tell them that do all the things that instructions that I have given you, and let us hope that you will not have to come to the hospital. That is my word that I tell my patients, and they are surprised, because there are 3 places where you don't go happily. One is hospital, another one is police station, and third one is court. These are the 3 places where you do not go for walk. Right? You only go when you are very much forced to go to those places. So I will always give an example to my patient that यो 3 ठाउँमा चाहिँ जाने ठाउँ होइन, त्यतिकै अस्पताल, थाना या पुलिस स्टेसन र अदालत. त्यसैले hospital is one of the place where you should not visit as much as possible.
Doctor, in English there are 2 nice words.
Yeah.
One is the victor and the other one is the vanquished.
Vanquished, yes.
In other words, what I'd like to say is victor and the vanquished.
Yeah.
So here, because of the nature of the topic we are dealing with today, we are dealing with actually 2 qualifications, 2 abilities. One is the victor and the vanquished. The vanquished is always a patient.
Yeah.
The victor is always a doctor. And it happens just the other way around at times, that the victor becomes vanquished.
Yeah.
So that is the very difficult situation. That
Right.
a doctor has to face. So I think it is really worthwhile to ponder at this kind of situation, like what would happen to me if I just lay on the hospital bed. Okay, doctor, you just went to the hospital, got admitted.
Yeah.
And then you recuperated and you got well and you just were on healthy or happy feet again, and then you resumed your duties, and I'm sure that you were very impatient to come over here, discharged from the hospital, and I think you didn't want to go home. I think you just wanted to come to the hospital and study and see the situation for yourself. Now, doctor, be honest.
Yeah.
Are you missing your days as a patient or as a doctor?
Of course, the answer is very obvious. I would never like to miss as being a patient, always I would like to miss being like a doctor.
Why do you think so?
Because I told you, it is not a pleasant moment to be a patient, because of course one thing is there, that when you are on the bed, you think on the bed that you are at the relaxing phase, okay, you have come to rest, but that is not true, because you have so many circumstances which do not let you rest over there. So that moment should not come to anybody, maybe a patient or a doctor.
So I assume that you feel that you really miss your patient days.
Yeah, in that way, the other way around, as you have expressed, that is okay. Yeah.
That's nice. Thank you for the answer. And now we are coming to a very, very strong topic.
Yeah.
That is, I should say, the conflict that arises between the patient and the doctor, the attending doctor. And accidents do happen, accidents here, not the road accident, but accidents in the hospital itself. That certainly the thing gets flared up, the patient is, let's say, he dies because of, I don't know, inverted commas, negligence of the doctor.
Right.
And the relative, the patient, they just make a lot of hullabaloo and they become violent. So what is that situation particularly?
This is very important question, and it is a very unfortunate situation at the same time. I would like to say something regarding these issues. Initially, these issues are not common, maybe before 15 years, 20 years back, because we suppose that the doctors who are entering, or the persons or the students who are entering the medical professions, their aim, their thought was to serve the people. And now even the government, as I said, has brought this medical profession as a business profession, number one. Number two, whichever field you are, you have earned a lot, but the respect was on this medical side. So people started thinking of both things at a time, the respect and the money both. And that is one of the basic situation psychology, I think, that one of the cause of this. But again, I want to say that I do not want to criticize my colleagues, honestly saying that most of the medical professionals are still honest to the patient, because we never want that our patient should die, or we don't want to care the patient, we care our patient. But some of the medical professionals, I would like to bring the truth here, they still now have started thinking that this is a really earning profession, or this is a business profession. So in that way, you try to extract, you try to excuse the patient. That few examples has created these situations for any even event where doctors are not at the fault. So even then the people try to blame, because that is one. Another aspect. The third aspect, the people's in between. You will learn, if you try to investigate, you will find it out, that I am sure, that the people, the patient parties are not so much aggressive. It is somebody in between, the political, the personal envies, and all this plays a role in between, and that creates this sort of situations to extract the money from the hospitals. This had become another business from those part who are trying to do that, and they are trying to influence the patient parties so that they can ask for the money and they get some part of it. So that has become another profession which leads to this type of situation. But still I would say that very few examples are there where patient dies because of the carelessness of the doctor or medical professionals. Most of them, they dies because of some unfortunate circumstances, and patient has to die because they die. So that is one of the reason. But some of the examples where there are carelessness, they are unfortunate, they should not be there. That sort of psychology should not be there with the doctors, and they say, and the capitation fee for the medical college is one of the very important factors that we should not forget, that I told you.
Yeah, Doctor, what is the health policy now doing? Are these doctors well protected?
Not at all, not at all. Even sometimes our neighbor countries' court has lot of such issues, and in that we have found that they have given a verdict that they cannot give a doctor a protection on words of the life of the patient. That was the statement of the judges. So doctors are not protected at all. This is another unfortunate part. So really the doctors are victimized sometimes without having any such sort of any fault or something like that.
So if there's no solution to that, even from the higher level, even from policy level and so on, so don't you think that this kind of situation will get even more aggravated, or it will just
worse.
go on and on?
Now, thing is that there are some solutions once the patient are insured. Insurance is one of the part of it. That is one of the solution that in other countries like European and the US and Europe, we do not have such circumstances because court is directly punishing a doctor, and patient parties cannot become aggressive like that, because there are courts which has got the medical jurisprudence investigations, and you first find out that whether it was a mistake of doctor or whether it was not a mistake of doctor. Here these are not done, because if you do that, the middle persons who are trying to earn, they will not get the money out of that. So it will go in channel. So it has to be channelized. Court has to be channelized in that way, so that it has to be investigated before you claim that a doctor has done mistake. And if the doctors are really has done mistake, of course, like in Europe and US, you are penalized. Your certificate is out. You are not allowed to practice. License is cancelled. Right? Council license is cancelled. So these are the things which may happen in near future in a country like this.
So let's hope that everything gets well.
Yeah.
The only thing is that the patient-doctor situation improves.
Yeah.
Improves to a full understanding that there are no mistakes from the medical side.
Yeah.
Or let's say, I mean, from the patient side too, must be very cooperative.
Right.
Let's hope that the situation will get better again, like I said earlier. And what we discussed today in this interview, an exclusive topic, a very special topic, doctor-patient's interview. And then we talked about many issues, doctor as a patient, and then again the situation that has arisen sometimes in terms of conflict situation between doctors and the patient, the hospital and the patients, and so on. So that we could give you some information on that. And Dr. Saab, I thank you from the very core of my heart that you really dealt with so many issues.
Yeah.
My questions were limited, but your views and ideas were really, praiseworthy, and I congratulate you.
Thank you. I think that was because your questions were extraordinary, and which was not expected in any interviews like this. And I would like to thank you for that. And I'm very impressed. But again, at last, I would like to say some message to the doctors and some message to the patient. For my colleagues, doctors, I respect all my colleagues, and I would like to say that never feel that you are greater than a patient. Always think that you are lucky. You should be thankful to the patient that you got chance to examine the patient and serve the patient. You are not helping, you are serving the patient.
Yes, that you are very lucky to have patients around.
Yes, that is very important, number one. For the patients, I would like to say, till the end of the effort, always doctor tries to do best for the patient. Most of the doctors, only few are there. Always there are exceptions everywhere. So exceptions are there in medical professions also. But most of we medical professionals, we try to help our patient. We do not try to, hurt our patients. Thank you so much.
So I just spoke to the eminent dermatologist of Nepal, Professor Dr. Anil Kumar Jha, who is also the chairman of DISHARC, DI Skin Health and Referral Centre, talking to me, Michael Chand, of the DIMCD, that we really had a good talk, and I thank you, Dr.
Thank you. Namaste. Thank you to everybody.